Good afternoon, everybody. My name is Dr. Cordelia Katureebe, and from Uganda, the Ministry of Health. I am a pediatrician public health specialist working in the division of the AIDS control program, where I lead strategy, policy guidance within the ministry for the HIV programming, and with a specific passion around health systems strengthening. I will be discussing my topic, which was optimizing mid-level health workforce at regional referral hospitals in Uganda under the broader theme of the reimagining investments in health systems capacity development. In Uganda, the regional referral hospitals are tertiary health facilities that have increasing mandate and demands to provide health services for catchment regions. And we know that the health workforce is a critical resource. The mid-level health workforce is a more critical resource, knowing that they make decisions at that level and stewards for health services in these facilities. However, there have been a lot of resource constraints. A lot of the priorities within the hospitals undermine the role that we have to play in terms of capacity building for this critical pool. In addition, the changing landscape of health, the epidemics, community needs, and increased demand for services also undermine the health workforce. We have seen now that the health workforce, there's a critical need in terms of them having increased diversity, a mixed skill set aside from what they do clinically, and increased performance to meet the dynamic health field. There's also need for us to leverage on opportunities like donor support if we are going to have sustainability for our health programs. Against this background, ensuring that the health workforce are stewards, we designed our intervention, which was literally looking at an in-service customized health system capacity development plan for 16 managers at 4 select regional referral hospitals. And we had the major aims of ensuring we have a diversified skill set across the different health system areas of finance, governance, and human resource. And ultimately, we wanted to see how the HR is optimized and their performance is improved for them to be able to deliver effectively, to ensure change management, and to have better employee experience. We went through a systematic approach of the interventions that we did, which included the stakeholder mapping. In this case, we had the 4 regional referrals on the table. We had our donor that supported the Ministry of Health, and we had institutions of learning that came together to identify the problem and identify what needed to be done in supporting this intervention. We had assessments in terms of gaps, and we had a participatory activity where we're able to prioritize which system areas were going to be addressed. And we then customized a capacity building plan and technical assistance that would be provided over time and set different indicators to monitor ourselves. We were able to achieve in this period the development of tools. And in this case, we developed a customized tool that would support building of capacity for finance. And we developed a comprehensive capacity plan that had timelines and different topics that would be taught in each of the hospitals and in delivery to the 16 people. And we ensured an evaluation assessment that was consisting of tools to be able to monitor each individual health worker that received services. We show clearly some of the voices of the recipients and just showing us that over time, some of the areas where they have learned around governance, increased ways of engaging, areas around finance, and these are from the mid-level healthcare providers. And so in conclusion, the early conclusion is that we see that investments in diversifying the health workforce are possible and needed now. And we need to continue that engaging with the critical stakeholders and calling them to action to increase domestic funding from host governments, and in this case, the regional referral hospitals to plan, the collaborative partners, the donors, educational institutions that impart learning, and also from the health workforce to see that we have increased advocacy from them to ensure that these are continuous and routine processes that happen within the hospitals. I thank you for listening.